IgG4 related disease is an autoimmune complaint where you present with a high level of a specific antibody, the IgG4 subtype antibody. This triggers an abnormal immune response that can cause inflammation in various organs. Over time, this inflammation can result in swelling, scarring, and damage to the affected organs. IgG4 is a subclass antibody. These are proteins produced by the immune system, antibodies. They help protect us from foreign substances like bacteria and viruses. Individuals who have IgG4 related disease, the immune system starts to behave abnormally. This leads to a chronic inflammation and production of these antibodies and potential organ damage as a result of this inflammation. This condition most commonly affects middle-aged individuals or those later in life. Slightly higher incidence are noted in men than women. The disease can affect people of all ages and genders, but it's very rare, so it's hard to get a prevalence, with the estimated prevalence of between 2 to 10 per million people in the UK. The disease seems to be more common in Asian populations, but it can occur in all regions as well. IgG4 disease can involve various organs. This could include the lymph nodes, the pancreas, the salivary glands, kidneys, and prostate. The pancreas seems to be commonly affected. Potentially, this can lead to conditions like diabetes, as the chronic inflammation destroys the insulin-producing cells in the pancreas. In the kidneys, it can lead to kidney failure. Inflammation of blood vessels can impair the kidney's ability to filter out waste from the body. If left undiagnosed or untreated, it can lead to permanent damage. Although the exact cause is unclear, it's thought to arise from genetic factors that are then triggered by environmental exposures. As we've heard, unusual level of IgG4 antibodies drive this condition. Because the condition is relatively rare, a full idea of how it might affect you is difficult to obtain. The condition can affect different organs, but the common signs would include pain, swelling, and dysfunction of the areas that are affected. Diagnosing IgG4 begins with an understanding of your story of symptoms, which we call the medical history. This is followed up by a physical examination. The kind of symptoms you may be asked about are swelling that might be visible in areas like the lymph nodes. The pancreas swelling may be detected incidentally. Blood tests can be used, but a specific test looking at the subtypes of IgG, particularly to see if there's an elevation in IgG4, is a key indicator of the disease. Imaging like a CT or an MRI can provide detailed images. Abnormalities may be affected, for example in the back of the body called the retroperitoneal area. In some cases, a biopsy of the affected tissue may be needed. This is most helpful to obtain a definitive diagnosis. Early diagnosis is crucial to prevent the complications that might happen without proper treatment. Once a diagnosis of IgG4 disease has been made, the treatment will be tailored to the specific organs affected and the severity of the condition. Corticosteroids or steroids are typically used first line. These reduce inflammation and alleviate symptoms and are quite effective in many patients. However, corticosteroids are not a long-term option. Frequently, immunosuppressive or disease-modifying antirheumatic drugs are used. In some cases, biological therapies may be used. Because of the rarity of this condition, research is ongoing to look at additional targeted treatments that may be of benefit for people with this condition. In most cases, treatment should be coordinated by a specialist. This might involve multiple specialists, with the rheumatologist usually taking the lead, but also involvement of gastroenterologists and endocrinologists provide more care. These specialists will monitor the disease and offer further treatments to optimize outcomes. Additional support from other non-medical specialties like physical therapy and occupational therapy may be helpful to manage other symptoms and improve mobility and strength. A holistic approach helps individuals maintain daily function and their quality of life. In summary, the condition will require a multidisciplinary approach. This is likely to be coordinated by a rheumatologist. Although the condition is still being researched to better understand how to treat patients, with early diagnosis and the right intervention, individuals with IgG4 can maintain a good quality of life.